Hello, this is Amelia Garibaldi presenting the Helling versus Carey case from 1974. Background to this case is patient Helling sought treatment from her ophthalmologist due to eye pain and irritation. She actually had angle glaucoma, but for many years the doctors didn't actually perform the right treatment and diagnosed her correctly. So for patients under 40 years old, a pressure test is often administered to determine if the patient has glaucoma, but the patient Helling was younger than 40 years old, and glaucoma is very rare in patients under 40 years old, so her doctors did not administer the test for many years. It was later determined with a pressure test that Helling was actually suffering from glaucoma, and it wasn't just irritation from contact lenses. And as a result, Helling suffered from permanent eye damage. She lost the entirety of her peripheral vision and a significant amount of her central vision. And this is irreversible damage that could have otherwise been avoided. She, the patient, eventually consulted other physicians and then filed a complaint against Dr. Carey and his partner, Dr. Laughlin, for negligence. The medical issue in this case is the treatment. Um, Helling did not receive a pressure test due to her age. However, this test could have been administered anyways. Um, the medical standard at the time did state that patients over the age of 40 required the test, and Helling was below the age of 40, but this test could have been administered um, because it's a low cost, low risk, and it could have really prevented permanent eye damage for Helling. So this legal issue is a medical malpractice case. It is a civil lawsuit where a patient, Helling, um, brought a problem against, or brought up a problem that she had against a healthcare professional. Um, the ophthalmologist did not provide correct standard of care, causing injury. The court's decision ruled in favor of Helling, the patient, um, while the ophthalmologist did comply with the set standard of medical care, they were still held liable because the court decided that while that is true, all people deserve that same protection, even if they are under the age of 40. Additionally, the court stated that the cost of administering the pressure test would have been worth it because it's a low cost and low risk and a quick procedure or quick test to administer. And it could have easily prevented a life-threatening condition and severe vision loss and permanent damage to Helling's vision. This court decision was very unique because it actually went against the standard of care that was set. It was a controversial decision because one, judges aren't actually medical experts. Um, Two, glaucoma is actually very rare for people under 40 years of age. Um, and three, physicians could now be held um, for legal liability even if they didn't actually deviate from the accepted standard of care. Like in this case, Dr. Carey and Laughlin actually did follow the standard of care that was set, but they could have gone above the standard of care to um, to come to a true diagnosis and prevent irreversible eye damage. People who agreed with the court's decision saw that a pressure test was low in cost, time, and risk, and therefore should have been administered for it to be reasonable care. And professional standards can't automatically control negligence law. So, what went wrong in this case? Providers did not order the pressure test, which was low cost and easy to perform, to check for glaucoma. And this test was absolutely worth it in comparison to the potential medical issues that Helling did end up experiencing. And two, Helling came in for care to Carey and Laughlin's office several times over the course of many, many years. And Helling's eye problems were just to be related to contact lenses. And then after many years, Helling actually did get a pressure test performed, and it was determined that she had glaucoma. And this was after she had lost all peripheral vision and a lot of her central vision as well. Implications for practice. This case really emphasized the need for reasonable care under the circumstances instead of referring exactly to the standard practice that's set, because there's going to be different cases and different situations for different patients. And so it's better to form reasonable care and go above the standard of care at times. Um, this case proves that physicians may be held negligent if they do not provide reasonable care, even if they do follow the set standard. So they may have to go further than the routine care when the situation warrants it. And this case also emphasized the importance of preventative screening. Um, in this case, a simple pressure test could have been administered, and it could have prevented a lot of the future problems that came with this case. So tests should be administered when they're low risk and low cost and easy to administer. So in conclusion, this case is very unique, because the doctors in this case did actually perform the medical standard practice for this situation, as Helling was not in the age bracket for automatically being tested for glaucoma. In this case, the pressure test should have been administered though, and it shows that physicians can still be held accountable for not fully examining patient, even if it's highly unlikely that that patient would be diagnosed for a certain disease. And physicians are required to provide a greater duty of care in certain situations. So it may not be enough for a physician to simply follow the standard of care, and at other times they may have to go beyond the standard of care to prevent more issues from coming in a healthcare situation. And here are my references. Thank you.